And this afternoon, I will be joined shortly, very, very shortly. Stanley Kenani will be joining me. There is also Dr. Titus Divala, who is quite renowned and has been doing tremendous work in this regard. Possibly he will be joining us very, very shortly indeed. This is iHub Online. This is one of the programs amongst many programs that we've had in the past in relation to COVID-19. So whilst we are waiting to be joined by these colleagues, let me give you a brief background of the issue that we'll be discussing this afternoon. Possibly before I give you a brief background, I see Dr. Divala as well as Stanley. They are all online. Hello. Hi, Doctor. Good afternoon.
Good afternoon, Malik. How are you?
Well, I cannot hear you quite so well, but
Oh,
I
okay.
hope that will be resolved. And Stanley, how are you this afternoon?
No, I'm very fine. Thank you.
Well, I guess it's me who has a problem hearing them, but
But
possibly
we can hear
that
you
will be
clearly.
resolved in a minute or so. These gentlemen are joining me this afternoon so that they should talk about the issue of COVID-19. Recently, there has been overwhelming statistics indicating that the disease or the infections are gaining traction and they are spreading widely, and the health facility in the country were overwhelmed, and in some cases supplies were inadequate, and a number of citizens took it upon themselves to really try and restock supplies in government facilities as well as in other facilities where the need was. Let me go straight to Dr. Divala so that you should give us some perspective as regards the statistics when it comes to COVID-19 in the country. If you could give us that brief background, Dr. Divala.
Thank you very much, Malik. I wonder if you're able to quickly share my slides. Is this the time, or you just want a quick round? Hello, Malik. Can you hear me?
Can you hear me?
Yes, I can now hear you.
Unfortunately, I cannot hear you. So if you could try to turn on, make sure that your mic is not on mute.
Sorry for the technical problems, but from my end, my mic is actually okay, and I can also hear you. I wonder, Stanley, if you can hear me as well.
Can you hear me now?
Yes, I can hear you.
Well, it really appears that we are having problems getting the doctor to hear us. So right now, let me try another way. You will bear with us for the inconvenience caused. So let us try another way around. Doctor, can you hear me now?
I can hear you. I wonder if you can hear me. Are you able to hear me now, Malik? Dear viewers, we're just waiting for Malik to organize the audio. Yeah, it seems there's a little bit of a breakdown between the panelists and his studio. So just bear with us if you can hear me. But don't leave, stay there. We'll start soon.
Doctor, can you hear me? Yeah, so it appears that, Doctor, it appears that there is two-way communication. It appears that I can hear you now. If you can please proceed. Doctor, can you hear me?
Yes, I can hear you loud and clear. Are you able to hear me? Do you want me to proceed? Hello, Malik. Do you want me to proceed?
Yeah, it seems we're having some problems with the equipment. So I don't know whether the panel discussion is going to proceed. And we're waiting for Malik to give us some feedback. So in the back of the studio, they say they can hear us, but then I don't know. The question was on Dr. Titus Divala to share the statistics of the COVID pandemic in Malawi, so that we know the current situation. So, good. So yes, they keep confirming that they can hear us. But I think for the moderator of the panel discussion, then Malik, I don't know whether it can be back so that we have some kind of direction instead of I or Dr. Divala continuing to talk without a particular direction. Malik, are you there? Well, it seems that I'm the one on the screen. And
I can hear you loud and clear. So if you may proceed, the audience can hear you. They can also hear me.
Yeah, but the thing is that it was Dr. Divala who was supposed to be talking and sharing statistics, and he said that, would you please show him or put on the screen for him the data that he has, like the slides. Are you able to put the slides on screen for Dr. Divala? The data that he has, like the slides. Are you able to put the slides on screen for Dr. Divala? Like the slides. Are you able to put the slides on screen for Dr. Divala?
Oh, wonderful. So if it's okay with you, Malik, wonderful. Did you want us to proceed now? So if it's okay with you, Malik, did you want us to proceed now? So if it's okay with you, Malik, do you want us to proceed now? It looks like the audience can hear us. Malik, do you want us to carry on? Onjezani, are you able to still hear me? Maybe Malik can go to the audience version of the software, and then we can proceed, and then he can come back on. Stanley, can you hear me? Or it's I'm the only one now. Thanks, Stanley. Yeah, so I guess we just wait a little bit for Malik to give us direction. But otherwise, ladies and gentlemen, I just wanted to put a little bit of context to the work that Onjezani and Thandi have kindly started. Very commendable work of trying as much as possible to help the nation essentially protect those people who are sick and are within hospitals, which are currently overwhelmed, both in numbers, but as well as also in equipment and supplies. So I was hoping to put the context by describing where the epidemic is now, and also just how it has just catapulted within a very short space of time and pushing everyone to limits. So that's what my few slides are going to be about. It's just 5 slides, and then I'll let Stanley speak for the rest of the time. Thank you. Thank you. So it looks like we can start now. Malik, you can carry on to the next slide. That's okay. So essentially, the status of the epidemic that I'll be describing today will be as of the end of day yesterday, That's the last report that the government released. We started off back in November 2019, hearing rumors of a new disease emerging in China. Maybe not much was heard back here in Malawi, but there was a discussion within Chinese circles, as reports are showing now. At the end of the year, the Chinese authorities informed the World Health Organization that the disease that they were experiencing was indeed new and was not responding to any form of treatment. Over time, the disease was spreading rapidly, and because of that kind of spread, it was deemed as not a mere outbreak, but an epidemic, because it was spreading to large parts of the Chinese territory. And with time, the global community started experiencing cases as well. And fast forward to a couple of months later, within a few months, essentially, the World Health Organization declared the disease as a disease of global importance. So that was just within a few weeks of being notified and noticing the heavy speed in terms of the caseload. In March, the World Health Organization, that was, I think, on the 11th of March, declared that COVID-19 is a pandemic, which essentially means it is a big outbreak that is spreading rapidly and going beyond a few continents. It's essentially at a level where it can go to all continents. Later on, the Malawi authorities, having seen the rapid spread of COVID-19 and the burden it was pushing on other governments beyond the country, declared on a state of national disaster, which allows the government to secure funding from elsewhere, but also mobilize resources within our borders and put measures that can control the epidemic. So that was on the 20th of March, and a lot of measures were put in place, including ensuring that workplaces are decongested, and ensuring that schools were later on closed as well, and public transport was limited to some degree, and risk communication, ensuring that the public is aware of the disease, was essentially intensified from that point going forward. So if you can look at the graph that was projecting, I guess, Malik, if you can bring it back. If you can bring back the graph, essentially what this graph is showing is that the epidemic, as you can see, started rather slowly and peaked. The gray line, which is on top, essentially are the new cases, and the blue line are the hospitalizations. These are people who get very sick and get into the hospital. And then the red line is people who sadly, and may souls rest in peace, who lost their lives. So the numbers, if you look at the period from the very beginning, on 2 April is when we lost the first, on 2 April is when we registered the first 3 cases, and then on 7 April, I think, is when we registered the first death. And these events peaked at the end of July and started going down, and had gone down by the time I was preparing this at the end of at the beginning of October. So this is up to 5 October. And what happens really with that is, once the numbers have gone down, you can comfortably say that we have completed a cycle of events for this epidemic. We just need to watch our behaviors and make sure that we keep it as low as possible. So the next slide. Malik, if you can go on the next slide. Yeah, this is fine, but you can go on there. On here, the most important thing is is what we've discussed. But on this one, it takes the very same graph, moving it forward to where we are now. So we should be now in week 53 or 54 of the epidemic. And you can see around December, that's week 50 thereabout, week 40 to week 50, that week 48 to week 50, that's the period when the cases started rising slowly. And at the end of December, which is perhaps the most important information for Onjezani and Thandi, at the end of December, we had 19 people in the hospital. But as of yesterday, we had 167 people in hospital. So if you go to the next slide, Malik, you get to understand how difficult that is for health facilities. So that's a very big jump from 16 all through to 167. If you press forward, so you'll see that cases also moved. At the end of December, the total registered. Our testing capacity is very low. These numbers are just there to support us to understand where we are. I'm sure as of now, there are close to millions of cases in the country. But these numbers do tell us that the disease has jumped from 6,000 to 11,000. So that jump, the relative difference between the two is what's important. And that, if you measure in percentages, the case numbers have increased by 79% in just 2 weeks. And the numbers of people who are in hospital at every time point has moved from 16 to 167 in just 2 weeks, which is nearly 1,000% rise. And in terms of death, not to scare you, but just for everyone to understand what is there and what we're dealing with in health facilities, we've moved. Just this period, for the total number of deaths that we have now, 59% have occurred in the past 2 weeks alone. So these numbers are rising rapidly, which means we need to take action. So if you can go forward, Mike. The action, I know the government has to do a lot. And I sympathize with you when you say there's no action from government. There is limited action at the moment. It's frustrating. But trust me, there's a lot that you and me can do on our own. It really starts with the very, very basic measures. It doesn't really start with closing schools or whatsoever. It starts with the very basic things. If we all could wear our face coverings, watch our distance, and wash our hands frequently, those very basic measures put in place religiously. And also movement. If you want to leave your home, it has to be for a very important reason. If you're able to limit that and follow the 3 W's that I've just described, you can in turn reduce the number of cases, which, if successfully reduced, translates into a reduction in number of people who need to be in hospital. If that is successfully done, eventually the total number of deaths reduces as well. But one thing to point out here is that whenever you practice good behavior today, the impact on COVID-19 is usually visible only 2-3 weeks later. What we are seeing now is a result of our behavior 2-3 weeks back, which is a peak period in terms of celebrations. Whatever we are doing today, if you're not wearing a mask today and you get the virus, if you are to get sick, Most people don't get sick, but some do. If you get sick, you get sick about 2 weeks later, and that's when the number of you will be registered as someone hospitalized. And if circumstances are very difficult in hospital, some people progress very rapidly, but a lot of people, it takes maybe another 2 weeks or a week or so. So these numbers, our good behaviors today are going to really benefit us 2-3 weeks later. So we have to be patient. We have to continue observing the good measures as much as possible. And don't anticipate the benefit right away, but know that the benefit will come later. Malik, if you can bring the slide back to the last stage. I just wanted to close this summary, which I hope has been helpful to just put this into context, by saying that if you support this initiative that Onjezani and Thandi are doing, you will have a lot of impact also on reducing life loss. When we're managing health conditions, we try several levels of prevention. The very first level is primary prevention, in which case is you and me observing these measures. The second level is you've already gotten infected, so the most important thing you need to do there is to help you survive. Survival depends on the capacity of our health facilities. Our health facilities at the moment are already full. Although they are taking in more numbers, it is because they have no choice, but they have to take us in. But their capacity is already beyond full, which means whatever equipment they have is not enough. Well, we know the government has the responsibility to bring those back, but I mean, you can do something about it. And thanks to these two distinguished citizens for taking the first steps towards raising funds. We don't need another fundraiser. Let's join hands with Onjezani and Thandi in their initiative as they work and support us to help reduce the number of people who die. If you support hospitals do their best, you will support saving lives, and you will have impact. Be assured, if you bring something that helps the hospital care for these patients, you will save a life. Thank you.
Well, thank you very much, Dr. Divala, and my sincere apologies for the inconvenience that we couldn't hear each other pretty well. So I have tried to connect to another device so that I can also follow through. Due to poor connectivity and social distancing, the audio technician couldn't join, but nonetheless, we have to do with what we can do with. Now, I would like, Stanley, I would like you to join me to continue from where Dr. Divala has left. In terms of, there is frustration out there, and there is also a sense of negligence based on the report that was released by the Ombudsman. Let's start from there. Was this initiative born out of frustration, or it was just out of benevolence? Stanley.
Oh, thank you very much. I think the Ombudsman's report is history, in my view. It happened, bad things happened. I think money that was initially identified in the first wave was not well managed. We have already talked about it on my wall and also in various other forums. In fact, the Ombudsman herself took lead in November to present her report. However, this initiative was born out of the sense of urgency. You see, we saw in the last 7 days the situation escalate, and we're following, the news about the number of cases that were being admitted to hospitals, some hospitals being overwhelmed. And then somehow we saw that we felt that there was need for us to step in as citizens. Yes, the government is doing a lot, and we have spent inordinate amounts of time trying to criticize the way of delivery, the way it is delivering its response. But at the same time, we also decided that as citizens, I think there is a way we could make a difference. We could chime in, not just wait for the tax. Usually in Malawi, we say, oh, no, we pay taxes. And therefore, because we pay taxes, the government should do everything. Yes, we pay taxes, but this situation we are in now, when a ship is sinking, there comes a point in time when they say all hands on deck. That means anybody who is on board needs to come and do something in order to help the ship, to stop the ship from sinking. So this is what we're trying to do as citizens, but also we have well wishers who are also coming in, and also they're not Malawians, but also chipping in. But the bulk of the donations is coming from Malawians. Malawians themselves, I have received very heart-rending stories just today. This morning, one lady said, yesterday I buried my brother. And people gave me some money as condolence, and then this 50,000 kwacha is left over from that. I would like to contribute it to the initiative. So she sent the money to our account. But another health worker in Zomba said, look, I'm a frontline health worker. I'm working to fight COVID, and I would like to contribute 12,000 kwacha to this fight. So we have these stories. We have people sending us 1,000 kwacha, 2,000 kwacha. Okay, we have a lawyer who was also at the forefront in the case during the elections period. He came to me, said, please don't mention my name, but I would like to put in 250,000 kwacha. So everybody, according to their pocket, some 1,000 kwacha, others. There's one gentleman who has asked me not to disclose his name, who has just given us 1 million kwacha, an amount of 1 million kwacha at once. So we are putting together this money, and we have set up a board to oversee the expenditure of this money. There's going to be Dr. Victor Mugonjetsi Miti, who is also president of the Society of Medical Doctors in Malawi. There's going to be Dr. Thandi Hara, who is Dr. Thandi Hara, who is normally known on social media as Thandi Pulimuheya. And there's myself. We are 3 people who are going to form a board that is going to trace each and every coin that is being donated to this effort. And we have identified various ways in which people can donate. You can send through PayPal, you can send through Airtel Money, you can send through TNM Pamba, you can send through my Malawi National Bank account, you can send through for those who are living in the US, I can give you an account of mine that is domiciled in Long Island in New York, in the US. And then those who are living even here in France, I can also give them an account in France, but another one in Switzerland. The idea is anybody from anywhere in the world, they should be able to donate. There's also a GoFundMe campaign that we launched. And people who are able to contribute through the GoFundMe, they can also contribute to GoFundMe. Eventually, all this money is going to be put in one account. So we'll show the people. We told you that we collected this much from PayPal, right? We have transferred this. It has come to this account, and it has come out as so much kwacha. So we'll put this in the National Bank account in Malawi, and then the board that we have put in place is going to verify that indeed all the money that was donated in all these places has been moved to the account in Malawi. And then we are talking to we're talking to suppliers in Malawi, suppliers of the critical, especially oxygen, is what is in great shortage. So we're talking to Afrox, for example, who supply oxygen. We want to buy each hospital according to the needs that are critical to it. We're not going to say, okay, just because we want to buy, let's say, flow meters, then or just buy flow meters, and even if, let's say, Mzuzu Hospital doesn't need flow meters, let's say maybe its critical shortage is medicine, or its critical shortage is maybe the cylinders that we give it flow meters. It will not work like that. We go to Mzuzu Central Hospital, we go to Zomba Central Hospital, we go to Lilongwe Kamuzu Central Hospital and Queen Elizabeth. Ask them, what are your most immediate needs? Then as a board will sit down, they have given us these needs. Let's buy, okay, let's get quotations. So we are going to work closely with the Society of Medical Doctors in Malawi, their secretariat, to help us solicit quotations, but we'll pay the money directly from my account to the suppliers, so that we are able not to lose our control on the money. We pay, we get the things, then we deliver. So the Society of Medical Doctors will help us to coordinate with the delivery, and other Malawians of goodwill on the ground who would want to monitor what we're doing. They're welcome. We go deliver, we come back to the public, and we account for the money. We say, okay, look, we took this money, you gave us so much, we have spent so much on cylinders, so much on oxygen itself. The oxygen itself is also another story, because here's how it works. The cylinder is like a container. It's an empty thing. One container costs 110,000 kwacha, according to the quote that we got from Afrox yesterday. 110,000 kwacha. This is empty, but you can feel oxygen in it. Oxygen itself is like per fill costs about, I think, 64,000 kwacha. Then you have now the flow meter that helps to regulate the flow of the oxygen from the cylinder itself into the human being. So that is also another business. And we're looking at all these components, because oxygen, talking to all the professionals, is number one component that is critically needed. Then there's medicine such as heparin that stops the clotting of blood. Even that, because this COVID is also making blood clot. And so this medicine is also critically needed. And they don't have it at central medical stores right now as we speak. So we're going to run around like headless chickens to find this heparin wherever we can find it. Buy it, take it to the central hospitals, give it to the medical doctors. Because we want action, and we're not saying we're going to take the whole week, whatever. Tomorrow, we must place the first orders, because we are action oriented. Tomorrow we place the first orders, and then once they say they can supply, whether they supply the same tomorrow or the day after tomorrow, we want this done at lightning speed. We'll do our best, but we are working also depending on the paces of other people. So I count on my colleagues, Dr. Tandhara and Dr. Miti, and also on the support of everybody, all of us who have come together and put in something. And even those who haven't, we ask them to come forward and try to put in whatever they can, because the house is burning now. We can't just sit there and say, oh, the government is not doing enough. Oh, the government should have done this, should have done that. Fine, I agree with that. And I've been at the forefront asking the government to try and do things differently. But there comes a time when you talk and then you do something.
All right, then I think I just have to cut you short. You seem to be well acquainted with the medical stuff there. You were explaining quite well the medicines that are being used and the cylinders and all that. But then how do you make sure that your efforts are in sync with what the central government is doing, other than working with the society for medical doctors themselves?
The government we know is doing whatever it's doing, but the reason we have roped in the president of the Society of Medical Doctors is because they also know very well, they are better placed to know what exactly the government is doing, and therefore, together with the hospitals that we are talking to, they know the gaps. We have our intervention rests on identification of the gaps. So we identify the gaps and then say, okay, regardless, because the needs are immense. Abana, this oxygen alone, just the buying of oxygen, with the number of patients that's exploding, it's indeterminate. And the situation itself, we don't know when it will end. The needs are immense. The government can do whatever it is doing, but Kamuzu Central Hospital, Mzuzu Central Hospital, all these hospitals, Zomba, Queen Elizabeth, they will still need a lot of oxygen at the end of the day. Just yesterday, the plant for oxygen at Kamuzu Central Hospital broke down. Okay? Now, even when it's working, it only manages to fill 64 cylinders in a single day. But the patients there, each patient needs at least 3 cylinders in a day. Now, it requires like 200. They need about 210 cylinders at any one time anyway. So the plant itself was producing was not even enough to meet the demand. That means they still have to buy from Afrox at the end of the day. They have to buy from Afrox. The government cannot have unlimited resources to just buy endlessly for all the hospitals, because apart from the central hospitals we're talking about, there are district hospitals where there are also immense needs. Even at Baira, Bottom Hospital in Nilongwe, as we speak, they don't even have the oxygen as we speak. I mean, they're just struggling. Patients are dying. So we will have to find a way of, I mean, wherever we can help the government fill the gap, we'll do so. And definitely that's why we have roped in medical professionals to be part of our board, so that we do not make decisions without being in sync with what the government is doing. Malik, are you there?
Well, thank you very much for that detailed analysis. And I hope that for the time being, we can go and take some comments that are beaming on the screen. For example, well, others are merely encouraging and commending your efforts, but also there are others that have other suggestions. For example, I saw another one who was talking about access. In your efforts, you are looking at access at the institutional level. But then there are others that are looking at individuals without the capacity to have the resources that are required for protection and managing infections or managing cases in the event that one of their own has been infected. So how are you making sure that, other than working with institutions, individuals can also benefit?
No, I'll go straight to the point on this one. Because the needs are so immense, we've got to start from somewhere. And we would be lying if we try to create the impression that will be a solution for all things to all people. At the present level, where we are looking at dousing the fires. So dousing the fires, somebody as we speak is gasping for breath, in need of oxygen, without which within 20 minutes that person will die. This is what we're trying to address. So the other issues, like in terms of preventive mechanisms at individual level, I'm afraid it's not something that we are considering to look at as of now. Now we are considering looking at or focusing on saving life. This very minute, what can we do to save life for those that are already critically affected? That is the focus. Dr. Divala has already explained at individual level in terms of preventive mechanisms. Dr. Divala has explained that we need to wash our hands and maintain social distancing and all that. But also pharmacies are selling some medicines that are, there's a good regimen that some people can follow. I'm not best placed to recommend whatever it is that pharmacies are selling, but also, people are circulating on social media some home remedies that people can follow. All those things at individual level, each person may want to try whatever they can. But at our level, we are just looking at dousing the fires, full stop. Malik, are you there?
Well, indeed, it's about dousing the fires right now. It's something that is really commendable. That's why when I noted the post, I reached out and so that we should amplify the message so that if possible, those that are interested may be of help. So those that are watching us right now, I can see the numbers. They are quite enormous. You may see below the screen there are numbers there that are scrolling. Those are the account details of one Stanley Kenani. But it's also of interest. There are others trying to create fraud out of this. Please take us through the experience so that people may be alert that they divert their resources to the rightful channel.
I think those who have followed my Facebook account for a long time know what is the correct account. And but there are others who have used my name on Stanley Kenani and have created their pages. To begin with, on my account, I don't have a photograph. There's a reason for that. So I don't have a photograph, and the reason is I set up that page to handle Malawian issues. It's not about me. So that's why I put less of myself on that page. So if you see there's an account that has got a photograph of me, it's a fake account, number one. Number two, this morning we saw that one of the thieves who set up this fake account put a different phone number for Airtel money collections. Within 15 minutes, somebody notified me, and then we were able to. I announced on my wall to stop people from to warn people against donating to these thieves. And then Airtel also helped us pretty quickly. They blocked that account. So I'm sending a strong warning to anybody who is trying to torpedo our efforts by cloning my account and making people, send money to thieves. Once we know this, the police will come after you, but also Airtel is going to block that account. Whether it's Airtel or TNM, we're going to approach them and they're going to block it pretty quick. So we want this moment not to create an opportunity for thieves, but we want this money to go and do the intended purpose. People are taking their little money. I've told you of somebody, a front worker, a health worker who is fighting COVID, taking 12,000 and they're not paid a lot of money. One thing, the people who are fighting COVID every day, putting their lives at risk rather, they are not paid enough money. They are not paid good incentives. So for this health worker to take 12,000 kwacha of the hard-earned money and give it to us to support our efforts, it would be a gratuitous insult for anybody to start, stealing from such people and say, oh no, just because they think that it's an easy way of making money. We will not allow that. Malik?
Well, thank you very much, Stan. One interesting question that I've just received privately, is Stanley interested in politics in any way? Because it seems that you are playing the card so well, so much so that you could fit the political arena.
I'm not interested in politics at all. The thing is, the problem that we have in Malawi is that politics seems to be everything. The thing is, right now, I mean, we should be able to just look at things objectively without using political lenses. I am not interested in running for any political position now or in future. I'm interested in my only wish is to make sure that we have a Malawi that works for everybody and that the poor are not shortchanged. And I've spent almost my entire life trying to speak for those whom I believe are voiceless, so that we should at least see the change that we need. So yeah, that's my response. Malik?
That we have had is really commending efforts. But there is something interesting here, Stanley. If you can see on the screen, I have put something on the screen there. I hope you can see it. It's a comment. We can't always ask or wait for the government to do everything. We Malawians have to take responsibility, and we have to take responsibility and do something about simple things like what is happening with Onjezani's initiative. Why can't some of us buy cloth and elastic and identify people with tailoring shops who may be willing to sew those and distribute to those in need, i.e. schools in rural areas, reusable masks that can be washed? I think that comes in as a recommendation, as something that might interest some of you to take over. Stanley, it's really been 54 minutes of chat. I know you have a very busy schedule, and I don't take it for granted. Having reached out to you in a short span, you responded in the positive. I can assure you that as iHub Online, we are partners in this in this fight, because of the little effort that we have done in the past with Dr. Divala. We have been privileged to be amongst the media institutions in Africa that have been given a grant, which is about 10,000 euro, which we are going to use to amplify such kind of messages. So in us, when it comes to matters related to COVID, we can assure you that you have a partner indeed. So whenever there is something that needs amplification, we are there as your partner.
Thank you very much. I take it that this is the end of the program. As Malik has said, thank you so much. My last words would be to continue appealing to the public to say that maybe, yes, I can see that Michael Kadumbo is asking, can we approach Minister of Finance so that they waive tax on COVID medicines and medical supplies and equipment? Definitely. I mean, we are going to lobby the Minister of Finance we're going to do this tomorrow. I'm going to have to write a letter to the Minister of Finance, and I'm going to email it to him and say would like to ask that taxes be waived on equipment to do with the fight for COVID. Because now people are donating all this money, and you find that maybe a sizable chunk of it, equipment, is going to taxes, and that is not going to be easy for us. But we'll see what the minister says. Thank you very much, everybody. I really have to go, and like Malik said, it's been a roller coaster. I need a lot of time to focus on what we're doing. I'm receiving scores of messages. I'm sorry to some people, I may take too much time not to respond to messages, but it's because I'm overwhelmed. I'm trying my best, and we'll do what we can.
Well, thank you very much, Stanley. We truly appreciate your efforts, and we don't take it for granted. Well, there are sincere apologies. In the initial phase, we had problems connecting the audio, but we were privileged indeed to have Stanley Kenani outlining some of the initiative. The initiative that he and a few other Malawians are championing to ensure that the suffering that some Malawians are going through are cushioned, and so that the war against COVID-19 should be smooth and resilient, so that we should be able to return to normalcy as soon as possible. So until some other time when we shall have another program, and I can promise you we'll have more, and most of these will be abrupt. Some of them will be programmed pretty well. You'll be informed well in advance, and it is about partnerships and collaborations that is really going to make us move forward, proceed and succeed against the war on COVID. And I would like to appreciate many of you that joined us in this conversation. Sitingo Wao, Chindikani Nyirenda, Michael Kadumbo, Fonet Nyirenda, Chisomo Piri, Enet Longwe, Raima, Risha Pat, Pam Anajamba, Chindikani Nyirenda, Abigail Bonongwe Aside, another comment, SK Piri, Mtiko Chiku, Mafongo Kibese Mpakani, Jinjason Manda, Tutufye Simwimba, Edith Mkwaira, one of the top cheerleaders, Dennis Iman, Adachunga, Liz Dalo, Pam Anachamba, Fortune Nichuongo, Hendrix Zimba. Thank you very much, Brenda Mohoni, for joining us in this program. We were live on iHub Online website, on iHub Online TV, on YouTube, as well as iHub Facebook Live. We hope you will keep telling your colleagues to follow our platforms, so that they follow events as they happen and whenever they happen. It has been a pleasure being with you, and I sincerely hope that you will continue to be loyal to this platform. Other than this, we also offer other services, live streaming of social events. As you are aware that now is a hard time for congregations to congregate in numbers. We offer live streaming services. We offer social media management to companies and individuals. We deal with digital marketing and live events. So in case you want some of these services, well, then you can reach us on 099, or rather 999-603-112. That is my personal number. We can talk business. But if it is about COVID and raising awareness, then we have this platform where we talk COVID, and that one is really for free. Until some other time, thank you very much for being in my company, And I truly appreciate Stanley Kenani as well as Dr. Divala for being so supportive each and every time we reach out. Until some other time, bye-bye.